Welcome. Today we're diving into a digestive condition that can cause significant abdominal pain, biliary dyskinesia. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Understanding this condition is key to managing its symptoms and improving quality of life. So, what exactly causes biliary dyskinesia? The precise etiology isn't fully understood, but it's believed to stem from a motor dysfunction of the gallbladder. This means the gallbladder isn't contracting and emptying bile properly, even though there may be no physical obstruction like gallstones. Possible contributing factors include abnormalities in the gallbladder muscle itself, hormonal imbalances affecting gallbladder function, and issues with the nerves that control gallbladder contractions. In some cases, it may be linked to other digestive disorders. To understand biliary dyskinesia, let's look at its pathophysiology. The gallbladder's primary role is to store and concentrate bile produced by the liver. When you eat, especially fatty foods, the gallbladder contracts to release bile into the small intestine to help with digestion. In biliary dyskinesia, this contraction process is impaired. The gallbladder might contract too weakly, too strongly, or in a discoordinated manner. This dysfunctional contraction leads to a buildup of bile, increased pressure within the gallbladder, and ultimately pain. Because the bile doesn't empty properly, it can also impact the breakdown and absorption of fats, potentially contributing to other digestive symptoms. Determining the exact number of people affected by biliary dyskinesia is challenging, as many cases likely go undiagnosed. It's estimated to be more prevalent in women, particularly those in their 20s to 40s. People with a history of digestive problems, hormonal imbalances, or certain medications may be at higher risk. Further research is needed to fully understand the true scope of this condition within the general population. The hallmark symptom of biliary dyskinesia is biliary type pain. This typically manifests as recurrent episodes of moderate to severe pain in the upper right abdomen, often described as a dull H or a sharp, cramping sensation. The pain can radiate to the back or right shoulder. Other common symptoms include nausea, vomiting, bloating, indigestion, and discomfort after eating fatty meals. Some individuals might also experience fatigue, diarrhea, or constipation. It's important to note that the symptoms can mimic other gallbladder problems, making accurate diagnosis crucial. Diagnosing biliary dyskinesia can be a process of elimination and requires a thorough evaluation. Your doctor will start with a physical exam and a detailed review of your medical history and symptoms. Blood tests are usually performed to rule out other conditions, such as liver or pancreatic problems. The key diagnostic test is a gallbladder ejection fraction scan, also known as a Heidi scan. During this scan, a radioactive tracer is injected into your bloodstream, allowing doctors to visualize the gallbladder and measure how effectively it contracts and empties bile. A low ejection fraction, typically below 35–40%, suggests that the gallbladder is not functioning properly and supports a diagnosis of biliary dyskinesia. Additional imaging, like an ultrasound, may be used to rule out gallstones or other structural abnormalities. While there aren't strictly defined types of biliary dyskinesia, it's helpful to consider it along a spectrum of severity. Some individuals might experience mild, infrequent symptoms, while others have more severe and debilitating episodes. The frequency and intensity of symptoms, along with the gallbladder ejection fraction, help guide treatment decisions. It can also be categorized in primary biliary dyskinesia, which is when there are not any other underlying problems, or secondary biliary dyskinesia, when it comes as a result of another condition. The primary treatment for biliary dyskinesia is typically surgical removal of the gallbladder, a procedure called a cholecystectomy. This is often performed laparoscopically, which involves small incisions and a faster recovery time. For individuals who are not good candidates for surgery, or who prefer to explore other options first, medications to help relax the gallbladder and improve bile flow may be prescribed, although their effectiveness is often limited. Dietary modifications, such as reducing fat intake, can also help manage symptoms. Pain management strategies, including over-the-counter or prescription pain relievers, may be used to alleviate discomfort during episodes. Unfortunately, there's no definitive way to prevent biliary dyskinesia, as the exact cause isn't fully understood. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding rapid weight loss, may help promote overall gallbladder health. If you have a family history of gallbladder problems, discussing preventative measures with your doctor may be beneficial. The prognosis for individuals with biliary dyskinesia who undergo cholecystectomy is generally good. Most people experience significant improvement in their symptoms after gallbladder removal. However, it's important to remember that some individuals may still experience digestive symptoms, such as bloating or diarrhea, even after surgery. This is because the body needs time to adjust to the absence of the gallbladder. Research is ongoing to better understand the underlying mechanisms of biliary dyskinesia and to develop more targeted and effective treatments. Recent studies are exploring the role of specific genetic factors and the potential for non-surgical interventions to improve gallbladder function. As our understanding of this condition evolves, so too will the available treatment options.